The other area I see in the post-COVID, and I know it's been going on the entire time we've had COVID and post-COVID, but it's getting more common now because I think we had so many people have COVID, we're noticing it more.
Yeah.
And that's the neuroinflammatory part of COVID, because all the same things that mess up your digestive function or make your liver release toxins or all these chemistry we have also makes your brain homeostasis, your brain ecology less stable.
Okay? Yeah.
So you see people, because you hear, let's pick an easy one that's super common, taste changes or loss of taste.
Yeah.
Some people 2, 3, 4 weeks and they get their taste back. Some people a year later, they still can't taste. Okay. People developed headaches. Some people, they went away. Some people still have them.
Right.
People develop, anxiety or sleep problems or whatever. COVID, we know now, can cause the same disease as a traumatic brain injury. So you could be in a bad car accident and hit your head super hard, lose consciousness, have a concussion, or you could have COVID and you could have the exact same problems afterwards. So the long-term neurological problems are also ones that are sneaky, and there's a lot of underlying things, a lot of these things we've talked about, that until they're addressed, you can give the person all the curcumin and boswellia you want and all these other things, and it'll help them, but they don't heal.
Right.
So there's a lot of trauma to lots of systems that, we really have to think of these core things we're talking about.
What kind of treatments do you like to give to people who are having the neurological issues more than anything else?
So I just did a physician training for this, and it wound up being 3 hours long, which nobody liked, but it was good stuff. And I reviewed, there's probably 1,000 papers, but I reviewed 50 of the most useful ones that have been published in the last year or so, all about COVID. Okay, we're on 99% about COVID. So there's a lot that's known about COVID and the nervous system. The communities that treat these problems, whether it's neurology, psychiatry, ear, nose, and throat, are even acknowledging that the standard treatments they would use aren't working that great.
Right.
And they're actually publishing that things that we might do, like platelet-rich plasma or stem cells or nutrients or other stuff, like they're actually putting in papers, look, we've never used these before, but these appear to maybe be helpful.
I love it.
None of the other treatments we have do. Yeah. So I say that to say that, number one, they have to be very desperate if they put that in a psychiatry journal or ENT journal.
Right.
But also it goes back to the fact, if you look at the science, the hardcore science for any neurological problem, it starts with what we knew very early in COVID, but now we know more mechanism that you hear about on the news, cytokines and cytokine storms and all this business. Well, right. Cytokines are just little chemicals that tell your immune system where to go, what to do. And they all do different things at different times. So they're very fun to try and track. Well, most of them that come along when you're dealing with COVID that might affect your brain, you don't notice right away because they're making you hurt or they're making, whatever. Well, what happens with the nervous system is the first insult is a 1-2 punch, where the fluid that protects and feeds your brain becomes more inflammatory with these little cytokines. And then the membranes that keep the fluid in your brain and safe and keep the blood out of your brain for the most part, and in the rest of your body, basically get holes in them. So they become like Swiss cheese. It's not supposed to be that way. So the number one protective mechanism family in your brain gets less protective,
Mhm.
then that allows more inflammation to go in, and your brain then, I would always tell patients, they say, why could one person get a headache and the other one gets anxiety and the other one maybe has nerve pain or something? It's because your brain does everything, and if one area of your brain gets more injured than the other, that area is going to give you symptoms that are wildly different than your neighbor got. So it's all the same problem, but if tends to be, for example, if you started out with a little anxiety, you might have a lot of anxiety, or if you start
Right.
out with little pain, you have a lot of pain, or maybe you get a new thing that you never had before. So in treatment, there's two levels. It's sort of like if you get a post-COVID patient, and there's those people where you get their diet dialed in, and they're on the nutrients that we talk about, and they start to exercise, get their muscles moving. 3-4 weeks, they're all better. That's not the patient we're talking about here. The
Right.
people who do all that and nothing happens, that person, then you have to step back and say, we have to fix the original insult.
Uh-huh.
And even the neurology and psychiatry literature, they say we have this blood-brain barrier problem, which is
Right.
not good. We don't have drugs that fix it, which you don't.
Mhm.
And so you have to start there and get your brain and your nervous system protected, and then you can fix the other problems. So this whole initial insult with inflammation in your blood-brain barrier, interestingly, although it shouldn't be because everything affects everything else, the hormone balance we were talking about is a huge part of getting that back online. What your body does usually under inflammation and acute infection and stuff is kind of shifts hormones towards maintenance during an infection. Okay, so if you're healthy, your cortisol will go up and estrogen will actually go up, and you'll kind of burn up your testosterone. Men or women, it goes down, and your progesterone and some of the other higher order hormones kind of drop
Mhm.
or drop a lot. Well, it turns out your blood-brain barrier is very sensitive to progesterone dropping and testosterone and DHEA dropping as they do and all that. And so one of the core things is, that hormone rebalancing kind of helps stabilize. Then there's, other things that, and again, in the standard research, the number one thing people are trying, because most people know about it, is curcumin.
Mhm.
And so in the few research papers where they've tried curcumin, of course, it works and it helps, so that,
Right.
there's a lot of other plant medicines that we know that help that way. So there are things like that, but then there's also things that we think of often not till we have like a chronic neurological disease or something to use, like and this again is in the standard literature now, acetylcarnitine, which we use a lot with neuro stuff. But it turns out that acutely in these post-COVID patients, that's very helpful. And
Mhm.
then all the other thing, which is at this core, very core level, is the mitochondrial damage that COVID causes.
Uh-huh.
And now there's papers that show that the brain mitochondria are hit very hard. So as with all of our chronically ill people, your mitochondria go down with you. Uh,
Yeah.
all the typical mitochondrial supports, you have to bring in. So it's really building from the very base up. And
Mhm.
that's probably why COVID is so uh, able to, dysregulate everything, is it really attacks base processes. Your blood-brain barrier is a pretty base process. Your kidney nephrons are a base process. The lining of your arteries is it's pretty important. So it goes to these places, your mitochondria. So I really think that's and we tend to sometimes come in swinging a little higher, and treating something obvious and missing the fact there's nothing's working anymore.